Hello and welcome. Today we're diving deep into a fascinating and often misunderstood condition, vestibular migraine. This neurological disorder can cause a dizzying array of symptoms, impacting balance, vision, and overall well-being. Join us as we explore its causes, symptoms, and potential treatments, shedding light on this complex condition. While the exact cause of vestibular migraine remains a bit of a mystery, researchers believe it's a complex interplay of genetic predisposition and environmental factors. It's thought to involve dysfunction in the brain's processing of sensory information, particularly related to balance and spatial orientation. Some triggers, such as stress, hormonal changes, certain foods, and changes in sleep patterns, are known to provoke attacks in susceptible individuals. The pathophysiology of vestibular migraine is complex, involving several brain regions and neurotransmitter systems. During a vestibular migraine attack, there's often an increase in neuronal excitability, particularly in areas of the brain that process sensory information, including the vestibular system, which is responsible for balance. This hyperexcitability can lead to the perception of vertigo, dizziness, and other vestibular symptoms. The trigeminal nerve, which is involved in migraine headaches, also plays a significant role, contributing to head pain and other associated symptoms. Neuroinflammation and changes in blood flow in the brain are also thought to be contributing factors. Vestibular migraine is more common than you might think, affecting an estimated 1% to 3% of the population. It's more prevalent in women than men, and it often begins in adulthood, typically between the ages of 30 and 50. However, it can occur at any age. Because the symptoms can be varied and overlap with other conditions, it's often underdiagnosed or misdiagnosed, highlighting the need for increased awareness and understanding. The hallmark of vestibular migraine is, of course, vertigo, a sensation of spinning or whirling. But the symptoms don't stop there. Many individuals experience dizziness, imbalance, nausea, and vomiting. Visual disturbances are also common, including blurred vision, sensitivity to light, photophobia, and sensitivity to movement, motion sickness. Headaches may or may not be present during an attack. Other possible symptoms include tinnitus, a ringing in the ears, a feeling of fullness in the ears, cognitive difficulties like trouble concentrating, and anxiety. Diagnosing vestibular migraine can be challenging, as there's no single definitive test. Diagnosis is typically based on a careful review of the patient's medical history, a thorough neurological examination, and the exclusion of other possible causes of vertigo and dizziness. Doctors often use diagnostic criteria established by the Buarnai Society and the International Headache Society to help guide the diagnosis. Additional tests, such as MRI scans of the brain and vestibular function tests, may be performed to rule out other conditions. While vestibular migraine doesn't have officially recognized subtypes, clinicians often classify it based on the presence or absence of headache during attacks. Some individuals experience vestibular symptoms with prominent headaches, while others have minimal or no head pain. Some recent research looks at specific triggers to classify them, but this is still a field in development. Treatment for vestibular migraine focuses on managing symptoms and preventing future attacks. Acute treatments aim to relieve symptoms during an attack and may include anti-nausea medications, vestibular suppressants, and pain relievers. Preventive treatments are aimed at reducing the frequency and severity of attacks. These may include lifestyle modifications, such as identifying and avoiding triggers, as well as medications like beta blockers, calcium channel blockers, antidepressants, and CGRP antagonists. Vestibular rehabilitation therapy, a type of physical therapy, can also be helpful in improving balance and reducing dizziness. Prevention plays a crucial role in managing vestibular migraine. Identifying and avoiding triggers is paramount. This may involve making dietary changes, such as avoiding caffeine, alcohol, and processed foods. Maintaining a regular sleep schedule, managing stress through relaxation techniques like yoga or meditation, and engaging in regular exercise can also be beneficial. Working closely with your healthcare provider to develop a personalized prevention plan is key. The prognosis for vestibular migraine varies from person to person. Some individuals experience infrequent attacks that are easily managed, while others have more frequent and debilitating symptoms. With appropriate diagnosis and treatment, many people are able to significantly reduce their symptoms and improve their quality of life. Research is ongoing to further understand the underlying mechanisms of vestibular migraine and to develop more effective treatments. Recent studies are exploring the potential of new medications that target specific neurotransmitters and pathways involved in the condition. Furthermore, the role of diet and gut health in managing vestibular migraine is being investigated. As our understanding of this complex condition grows, so too will our ability to provide better care and improve the lives of those affected.